Well, hi everyone, I'm Ben, and today I'm with Simon, our training manager, and we're going to talk about everything clinical workshops. So by the end of this video, you should know exactly what to expect and how to prepare for your very first workshop.
Yeah, that's right. Workshops being such an integral part of the course and something that most students find really exciting.
And possibly a little bit scary too, Simon.
Look, potentially you could be a bit anxious about them, but we're aware of all those concerns, and we do a lot of work in the beginning of the workshops to make sure you're introduced to everyone and that you know exactly what's about to happen and really what's expected of you.
Okay, so it's my very first workshop, kind of a little nervous, but what do I expect when I turn up?
Sure, okay. I mean, we'll normally have around a dozen students and 2 or 3 trainers in every workshop. Basically, the workshops are structured around teaching skills, and we just build upon them throughout the week. And so each skill will do a short theoretical session followed by a demonstration. Then we'll break into small groups and everyone gets to play with the gear, see how it works, make mistakes. The trainers come around, answer any questions, and we just slowly build you up in that way.
Okay, so what do I wear and what do I need to bring?
Yeah, sure. So the students just wear a standard paramedic uniform, so just pants and shoes. We actually give you a t-shirt to wear. As for what to bring, obviously a winning attitude helps. Apart from that, we provide everything that you're going to need. I would recommend you bring your own notepad and pen. Most students find that really helpful. And most students also have their own stethoscope, and I'd advise them to bring that and get comfortable using their own.
All right, so what sort of skills and topics are covered in the workshop?
Sure, so workshop 1 is really about patient assessment. So we talk about primary survey, secondary survey, all the vital signs and using all that equipment. It's really about figuring out what's wrong with the patient. We do a little bit of management as well in workshop 1, and workshop 2 we build upon that skill set and put in a lot more advanced skills.
All right, so obviously there's going to be assessments at the workshop. No one really likes that word, but hey, we've got to become comfortable with assessments. How are they conducted at workshop?
Yeah, sure. Look, I think the way that I would visualize assessments as a student, they're just a way for you to demonstrate competence. All we want to know is that you're safe. Okay, you don't have to treat your patients exactly the way I would treat them, you just have to do it in a safe way. Now, the way that we run our assessments, there's sort of 2 main types. We do some during the week on little bits and pieces, so maybe watching you take a blood pressure or an ECG, and we can sign you off as competent in that skill. But we also combine all the skills together and move you towards what we call a scenario. The scenario is a bit of a mainstay of the healthcare profession. There'll be a simulated patient and you're required to role play assessing them and providing any management that you might need.
Could you give me an example of what a scenario might be?
Certainly, yeah. So I suppose a really common one, a patient with chest pain. A lot of things going on in the chest. There's hearts, there's lungs, there's blood vessels, there's muscles, bones. When they've got the pain, you need to be able to figure out, well, what's causing this pain and how do I treat it? So your assessment is all about figuring out which aspect do I need to treat, and then your management. So for example, if you decided it was cardiac pain, what medications are you going to give? What route are you going to give them in? What dose? All those kinds of things, so we know that you can safely assess a patient and provide the right management.
Okay. And what happens if I kind of stuff it up? Do I get another chance?
You do, yes. So again, assessments are about safety and competence. So you don't fail on little things and you don't fail on inconsequential things either. The only reason someone would be deemed not competent is if they weren't able to demonstrate safety. If that were to happen, we sit you down, give you a cup of tea and a bicky, calm things down and make sure that we can address that skills gap, whatever it is. Now, we often find students already know why they failed. So they'll finish their scenario and they'll say, I did this wrong, or I forgot to do this. Perfect, you already know why. We'll talk about what went wrong, we'll address the skills gap, and then you get another go. Now, most students pass on their first assessment, but the second one is just there as a buffer, so we can give you that second chance. We want everyone to pass.
Okay, so how do I really know that I'm ready for workshop, and do I need to memorise everything or anything?
Yeah, great question. So you're ready for the workshop once you've completed the online lessons. If you completed them, some of those lessons maybe 8 months ago, it would be a really good idea to refresh that content.
Okay.
But if you've completed those modules, you're ready for the workshops. As for memorising, no, you're not expected to have memorised all that content. We review it during the workshops. There are some things that by the time you get to your assessment, you will need to have memorised, but we'll guide you on that. And there's really no point starting before the workshop.
All right, I think I'm just about ready to come to workshop, but you mentioned the winning attitude before. What's the winning attitude coming to workshop?
When we talk about a winning attitude, what we mean is students who are willing to come and really engage with the lessons, practice with all the gear, make all those mistakes and do all that learning, are expected to do very well in the assessments. If you're one of those students who likes to hang back and maybe watch other people do it, a lot of the time you might find it difficult when it comes to the assessments. Really the only way to learn this kind of skill-heavy content is to get your hands dirty and play with the gear.
Awesome. Well, Simon, thanks so much for just laying all that out for us. I hope that's answered all of your questions.
Yeah, no worries, and look forward to seeing everyone in workshop.
See you soon.